It's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today's question is about what's the difference between BiPAP and CPAP. It's a question we get quite frequently, and I think it is important for families in intensive care to know that. Now, what makes me qualified to talk about these topics? I am a critical care nurse by background. I have been working in intensive care and critical care for over 20 years in 3 different countries, where I also worked as a nurse unit manager for over 5 years. And I have been consulting and advocating for families in intensive care all over the world for the last 10 years as part of my intensivecarehotline.com platform here. So let's get right into answering today's questions. BiPAP and CPAP are both devices used in the treatment of sleep apnea, as well as, for example, respiratory failure type 1 and respiratory failure type 2, as well as sleep apnea, of course. But it is also sometimes used for neurological conditions. It's used for post-extubation when someone comes off the ventilator with a breathing tube. But I'll come to that in more detail in a minute. So CPAP provides a continuous stream of air at a fixed pressure to keep the airways open, preventing pauses in breathing. It's commonly used for obstructive sleep apnea. Because this is an intensive care channel, CPAP is often used in the community for sleep apnea, but in intensive care, it's often used, to prevent either intubation or to prevent re-intubation when patients are extubated. BiPAP, on the other hand, offers 2 different pressure levels, a higher pressure for inhalation and a lower pressure for exhalation. This dual-level approach can be more comfortable for some individuals. It's often prescribed for those who have trouble with CPAP or have certain medical conditions, including high CO2, high PCO2, and have type 2 respiratory failure. In summary, while CPAP provides a constant pressure, BiPAP provides different pressures for inhalation and exhalation, offering a more customizable breathing support. Now, like I said, in intensive care in particular, patients that are extubated, for example, they may struggle to breathe spontaneously, and they might just need a little bit of CPAP or a little bit of BiPAP. That's also guided by arterial blood gases, for example. If you have a low PO2, a low oxygen level in the blood, a little bit of CPAP might be sufficient. If you have a low PO2 and a high CO2, you probably need some BiPAP, right? This is after extubation, after removal of the breathing tube, when people are struggling to breathe. Now, when patients go into intensive care, they might also be started on BiPAP or on CPAP with the mask, right, to prevent intubation. Maybe the intensive care team thinks they're not quite ready, they don't need intubation. Let's just help them with breathing with CPAP or with BiPAP, check arterial blood gases and see whether ventilation with BiPAP or CPAP is sufficient, And if it is, then that's a good thing, because then no intubation is needed. You want to avoid intubation whenever you can. So I hope that helps and that explains the difference from BiPAP to CPAP. In essence, CPAP, 1 level of pressure, which is also known as PEEP, positive end expiratory pressure. In BiPAP, it's often PEEP and pressure support, or IPAP and EPAP. Don't want to get too medical here, but that gives you a really quick understanding of what the difference between CPAP and BiPAP is. I hope that helps. If you need help when you have a loved one in intensive care, go to intensivecarehotline.com, call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com with your questions. We also have a membership for families of critically ill patients in intensive care, and you can get access to the membership when you go to intensivecarehotline.com and click on the membership link, or you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. I also offer one-on-one consulting and advocacy for families in intensive care over the phone, via Zoom, Skype, WhatsApp, whichever medium works best for you. I talk to you and your families directly and I help you, or I talk to doctors and nurses directly. And I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one in intensive care, so that you can make informed decisions have peace of mind, control, power, and influence. I also represent you in family meetings with intensive care teams, and I, help you whether you should consider even going into a family meeting with intensive care teams. That is a consideration you need to make, whether you should even go to a family meeting in intensive care. But I can help you with all of that with my one-on-one consulting and advocacy, so that you make informed decisions, have peace of mind, control, power, and influence. We also offer medical record reviews in real time, so that you can get a second opinion in real time when you have a loved one in intensive care. Once again, all with the goal of making informed decisions, have peace of mind, control, power, and influence. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. Now, if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thanks for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.